Today on the Dr. Steve Show, how a motorcycle accident years ago left a dangerous condition lurking in one man's leg. Meet the surgeon who diagnosed it and surgically removed it without putting his patient under the knife.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, you may not realize it, but men can suffer from varicose veins as well. It's not just a woman's problem. And joining me now is Dr. David Greuner. He's a cardiovascular surgeon. David, good to see you again.
Thank you for having me on.
So I wanted to talk about varicose veins in men because a lot of people think it's a woman's problem, but guys can get this too.
Absolutely.
Do you see a lot of that in your office?
We see probably about 10% men in our office.
But the thing is, in the end, really they're coming in with the same complaints of, like, you know, disfiguring veins in their legs that are bothering them. And you had a case recently that I wanted to talk about a guy who had an injury in the past, and then he came to see you. Tell me about that.
Correct. We had a kind of adrenaline junkie, a guy that was a motorcyclist, and about 10 years ago he suffered a traumatic injury where he trapped his leg, crushing the deep vein in his leg, causing a deep vein thrombosis.
Or a clot, basically, in one of the veins. And what did that cause residual in his leg?
So some of the clot resolved over time, but some of it stayed in his leg, which elevated the vein pressures in his leg by obstructing drainage. So in addition to pain and swelling, he was also having a lot of varicose veins.
Right, so we have a picture of what that looks like for people that don't know, but basically it's these large, distended veins, disfigured, very cosmetically unappealing.
Correct.
Right. Okay. So, guy walks in your office. This is what you see. What's one of the first things that you do to get to the bottom of his problem?
One of the first things that we do on pretty much all patients is a duplex ultrasound. So, ultrasound has undergone a lot of changes over the years. It's much higher definition and much more information on a very non-invasive, non-painful test that was not available before.
Right. So basically, I want people to understand at home, this is a painless procedure to get to the bottom of something that's going on and causing you a problem. All right. So you diagnose his problem. What's the next step to treating him?
The next step, well, he was a little bit more advanced than most people. We had to do an X-ray guided procedure to image the veins deep down in his abdomen. We don't usually do that for most people, but we did this because of his history. But the next step is, in general, to perform an ablation procedure or seal the veins using a minimally invasive approach with a laser.
All right, so what does that involve exactly? Could you explain it? I know we have an animation of how that works. Go ahead.
Sure. In our practice, we use what's called the no-knife endovenous ablation, which is a laser fiber that goes through a needle no larger than the size used to draw blood, and it seals the vein using the ultrasound as a guide from the inside out.
Right, so basically a pretty painless procedure. Absolutely. And you use a laser, and what are the results with something like that?
Amazing. Very good results.
Right. Now, is this covered by insurance? Would people get coverage for that?
In most cases, yeah.
Okay, and what would the recovery be for something like that?
Typically, most of our patients go back to work the same day.
Really? And follow-up?
We usually check an ultrasound at about 3 to 7 days afterwards to demonstrate two things. Number one, that the vein is closed and everything is okay, and B, that there's no problems with other veins that we did not close, that blood is rerouted through. All right, Dr. David Greuner, thanks so much for coming in. The important message here is that, guys, if you have this problem, it can be fixed. You don't have to live with those large varicose veins.